My name is Dwight Slough. I'm the owner of DHS Financial Services in Harrisonburg, Virginia. I'm putting together just a few minutes of a video to help explain two terms that I think are very important to you. But before I do that, let me tell you why that I'm sending this video to you through email. Recently I did a mailing in your area in which you responded by sending back this little pink card that talks about government health care benefits. As a result of that, I have sent to you this new changes in the government health care benefits brochure. In that, it gives you some information as it relates to Medicare. But there's something that wasn't included there because, again, there's only so much you can put in a trifold brochure. And that is the difference between observation status versus being admitted as an inpatient. And there's a big difference. In observation status, you're going in, and instead of going under Part A, which is your hospital part, which again your Medicare supplement would pay for any co-pays, co-insurance, and so forth, so essentially there's nothing out of pocket. Under observation status, it gets picked up under Part B, which is your medical insurance. In doing that, it could cause you some additional money that you have to pay out of pocket. For instance, let's say that you suffer a stroke and you go into the emergency room. As you go in, you're put in observation status. Then you're admitted to the hospital still under observation status. What happens to you is when you leave that facility, and if you have to go to a skilled facility where you're taking physical therapy, speech therapy, perhaps occupational therapy, you're not going to be able to have all that covered. There's going to be 20% that's going to be your responsibility, and as such, it is uncapped. So you're talking tens of thousands of dollars if you were discharged from the hospital under observation status. So what you need to do is make sure a loved one or you check each day to make sure that you're admitted as an inpatient and not outpatient. Let me give you some numbers as it relates to that. Federal data shows that the number of Medicare patients classified as under observation has jumped recently in the past few years to 1.4 million rather in 2011 from 920,000 in 2006. What this means is that Medicare back in around 2008 decided that they wanted to crack down on fraud. So they've gone to the hospital and to the administrators and saying, listen, we want to make sure that we're not sending money for people that should be in observation status and not as an inpatient. If you're putting them inpatient when they should be observation, we're not going to pay you your Medicare reimbursement. So therefore, the hospitals have decided to err on the safe side and just simply say, you know what, we're going to go ahead and we're going to put this into observation status where it falls under Part B. You're going to pay your 20%. It's uncapped, and therefore we know we're going to get paid some money. Again, these are things that you need to be aware of. Patients leaving the hospital for a nursing facility after an observation stay pay the full cost out of pocket, and they give you some different numbers here. In some instances, it could be over $34,440. I know NBC did a piece a few years back where a gentleman had the stroke, went to the hospital, was observation status. His wife argued successfully there at the hospital to get it changed. He went to the skilled nursing facility. When she got her EOB, explanation of benefit statement, it was over $18,000 that if she had not had it changed from observation status to inpatient status, would have cost them a series of lots of money. Hospitals generally aren't required to notify patients that they're on observation status. So therefore, it's important for you to make sure that your loved one or whoever's overseeing your care covers that with them and make sure at that time. You want to try to get the doctor to change it while you're in the hospital. You can appeal it later through Medicare, but it's going to take a lot longer time, and they're not going to be in any hurry to try to overturn that. One final thing, again, my name is Dwight Slough. This is in response to a mailer that I sent you that you sent back to me. I'm going to be contacting you next week or so. Please take my call. I have some interesting information I need to share with you, and I'd also like to provide you with a quote on Medicare supplement, as I know that your birthday is coming up here in November. Thank you so much for taking the time to watch this. Again, my name is Dwight Slough, DHS Financial Services in Harrisonburg, Virginia. I've been in business since 2001. I'm A+ rated by the Better Business Bureau, and I thank you for your time.